Hey everybody, welcome back. Episode 3166 on the show. If you want to follow along and read the community's questions, head on over to stephencabral.com/3166. Of course, if you haven't already picked up your copy of The Rain Barrel Effect, feel free to do so. As I said, it's completely free. I pay for the book to be printed. You just pay for the shipping, which is just about $7, and you get it shipped to your home anywhere in the US. If you are international, head on over to stephencabral.com/shop. That's where my book is. That's where all of the labs are. That's where all of our protocols are. All right, let's dive into today's show. First question. Again, all things wellness, weight loss, weight gain, anti-aging. That's what we do every weekend. We answer about a dozen of our community's questions, as many as we can in about 15 minutes time. I respect your time. I appreciate many of you tuning in every single day to the show. So my goal is 15 minutes a day, get you really in on a new health topic and continue to build that education over time. All right. Raquel's up first. He or she says, hi, I wanted to know if it's possible to get rid of food and environmental allergies. I cannot tolerate fruits, vegetables, nuts, and nickel-containing products due to these. Even if I cook everything, I still get an itchy mouth, wheezing, and/or vomiting and diarrhea. I did an IgE blood and skin testing and was allergic to everything tested. I also tried allergy shots for 5 years. I have IBS-D, and fiber grains are a major trigger. The one thing that has worked to reduce my symptoms, hives, itchy mouth, asthma, diarrhea, is to eat an elimination diet, but I'm worried about this long term. I'm allergic to Hispro, sinus support, supplements, etc., with any types of plants in them. Any help would be greatly appreciated. Okay, so the biggest recommendation here is always look for, always ask the question, why? So right now, you're sensitive to basically all lectins and oxalates and anything that could trigger inflammation in the body. So again, I'll give you my disclaimer, can't provide any medical advice, medical treatment plans, medical cures, or medical diagnosis. Oftentimes people with this are Th2 immune dominant. Anyone with IBS, obviously there's inflammation in the digestive system. So first and foremost, we try to calm inflammation. So we go on a nutrition plan that isn't inflammatory. However, the goal is to repair the 26 feet of digestive tract. So we need to look at doing that very slowly, introducing one new supplement at a time, which in this case, we would look at, the most benign to just help with overall inflammation, vitamin D, zinc, a little magnesium, omega-3s. This is what we would do to just gently work at first. And then but we need to run the labs first. So the labs would be the big three. They would be the IgG, food sensitivity, not IgE. They would be the bacteria and parasite stool test. And it would be the Candida metabolic and vitamins test. That's called the big three. So that's at least where we'd start for what's going on with the gut to find out if it's H. pylori, parasites, Candida, or bacterial overgrowth. And so that's really how we start. And for a case this sensitive, you really want to be working one-on-one with a monthly call each month with an integrative health practitioner or an Equal Life health coach. Okay? As there's going to be so much back and forth to help. Matthew's up next. My mother saw her doctor and he told her that her heart is not pumping enough blood throughout her body and she needs to see a specialist. Now on the allopathic side, I know they're going to have her take heart medication. I know my experience that heart medication causes so many problems over time, just like other medication causes. I want to know what she can do for a naturopathic functional medicine perspective, or should I say try before she goes into the medication aspect? Because from the sounds of it, to me, her EF or ejection fracture is lower than it should be. I may be wrong, but that's what it sounds like to me. I'm hoping you can help. Yeah, and you very well may be absolutely correct on that as the diagnosis. I haven't seen it, so I don't know. This can happen as people get older, deconditioned, inflamed, and much more. So my goal is this. She's going to work with her allopathic specialist. This is probably going to be a cardiologist, right? A specialist with the heart. And she may decide to use medication. And that's going to be more important, much more important for people who are not as open to beginning an exercise regimen slowly at first to build up, which means walking, right? That's at first, then some more advanced cardio, and then some body weight training, and then, moving up from there. Then looking at something like the daily foundational protocol level 2, right, with vitamin D and D3 and K2. But again, I can't give you any of this. She'd have to check with her cardiologist. I'm just giving recommendations if this was my own mom. And then again, we're just gently working up. So here's what I would do. I would get her a copy of the Rain Barrel Effect. If she's open to reading it and she's responsive and she wants to be a part of it, phenomenal. Then you start to work her into the process. She can lab test first, or she can just begin to start to get into some natural health, some walking, and really begin to work the process. Eventually, maybe some sauna, which is great for cardiovascular, etc. So, Matthew, totally understand where you're coming from. Keep on fighting the good fight. That's what it's all about, helping others. Amy's up next. Should one take a break from berberine need to be stopped after taking it 6 months? It's the only thing that stopped my hot flashes, so I don't want to stop. Okay, well, so we're big believers in berberine. We have a product called Berberine Plus. It's also mixed with cinnulin, which is a super powerful antioxidant from cinnamon. It's an extract, very, very powerful. So clinical dosage, 1,000 to 1,500 milligrams per day, which is 3 capsules. Typically in our practice, we use 2 capsules because it's strong and it works great. Some people may need 3. They can use that for, again, I'm not giving you any diagnosis or medical treatment here, but I did share all of the science that shows it's amazing for non-alcoholic fatty liver disease. It can be very helpful with PCOS, with blood sugar issues, hormones, gut health, etc. Okay, so some people never stop and they just go down to the lowest possible dose, which is 500 milligrams. So you might try lowering your dose and then say, oh, wow, instead of 1,500 milligrams, I could take 1,000. And then you do that for a couple of weeks and you go down to 500 milligrams. Like, oh, yeah, I can actually just take 500 milligrams. Great. And then after that, maybe in another couple months, you try to wean off of it if you choose to. Okay. Some people do, some people don't. All right, Maria is up next. Why does the heat of the sun make me feel sick? Great question, Maria. So there are many different reasons, and I'm going to give you a bunch off the top of my head. The first one is dehydration. It is a big one. If you've been out in the sun for a while, you become dehydrated, you're going to become tired, potentially fatigued, potentially nauseous. The second, you're in the sun too long, it can cause inflammation. It can cause inflammation from the sun itself on the skin, obviously if you get a sunburn, but it can also increase heat-induced inflammation. Okay, now going back to heat, you can get heat exhaustion. So the heat actually raises your heart rate. Believe it or not, if the temperature is above 90 degrees and I'm outside, regular walking around heart rate for me might be like in the high 60s, low 70s. My sleeping heart rate might be like 54 or so. I know, some people are a little higher, some people are a little lower, all of that's good. But when I'm out and it's above 90 degrees, my heart rate could be in the high 80s, low 90s. It's like the heat can really affect you and some more than others. So just kind of think about that. The other is histamine-based reaction. I think we talked about that on yesterday's show. Heat-induced histamine reactions. And all of that can absolutely cause brain fog, fatigue, nausea, etc. So there's a few different reasons. I'm sure there's more, but those are all the different ways. So keep yourself hydrated. Wear a sun shirt if you need to. They kind of keep you cool. Those dry fit sun shirts. And stay hydrated. Maybe take some Hispro, which has quercetin in it, vitamin C that helps with histamines, and work from there. All right, let's get in one more question. This next one is from Jillian. Jillian says, my 3.5-year-old daughter develops a cough that can last a month or more after being sick. This cough wakes her up at night, sometimes causing her to vomit from coughing so hard. During these times, she will cough after running around also. This happens every few months with some time in between with no symptoms. It seems like asthma that I'm unsure of what to do. How safe are breathing treatments and inhalers for children? Does this mean she requires antibiotics to clear an infection from a lingering sickness? Most importantly, why would this be happening to her? Would removing tonsils help? I'm trying to weigh the pros and cons of treating her with Western medicine led into B and seeing if it stops as she gets older. She's only had antibiotics once in her life and eats fairly well for a toddler. Okay, so I, of course, can't give you a diagnosis for this, but it also very well be just post-viral or it's probably not a bacterial infection, but post-infection, we'll call it. It could be viral infection, post-nasal drip. And so post-nasal drip kicks up the most at night. And I think I have a whole show just on why it kicks up more at night. So that's an important one to look at. And then also, it can kick up with exercise, with running around. So like your sinuses begin to drain more. So if this is what it is, there are multiple reasons why. Inflammation can cause this. There's no doubt about it. But oftentimes, food sensitivities can be a trigger for this. I just want to let you know, and I'll probably share a personal story about this on an upcoming show. But for me, I did not get rid of real off and on postnasal drip issues, which was part of my fatigue, until I stopped all dairy, all cow's milk dairy. I can't begin to stress that enough. I always had congestion. I could not breathe through my nose because it was so inflamed until I got rid of all dairy. And it's not like that for everyone, but certainly was for me. And so I would say, if you can, run the food sensitivity test. Your daughter's 3.5. That test is available for ages 3 years old and up. And remove the foods that she's sensitive to, which also may make her then less inflamed and also less likely maybe to catch some of the colds, although catching a cold is normal as a kid. Okay, so that's what I would do. You can also use a neti pot if you choose to just kind of try to clean and drain that area. You can, if the tonsils are swollen, you can use my tonsil protocol. And if you can't find these at stephencabral.com/podcast, just write into cabralsupportgroup.com. cabralsupportgroup.com. Write in, just say, what is Dr. Cabral's tonsil protocol? What is, and we'll get you all of those answers, okay? So that's what I have my daughters do. They gargle that to shrink the tonsils. It doesn't happen overnight, but that's what we do because, yes, inflamed tonsils could be an issue. So much. But again, let's start, if we can, with the food sensitivity testing. Let's begin there. And if you don't want to do the food sensitivity testing, then maybe, again, I'm not giving any treatment plans, but this is what I would do if it was my daughters. I would at least eliminate gluten, dairy, and eggs. And I know it seems like a lot, but just do it for 3 to 4 weeks. See if it makes a difference. And there's so many substitutes now. It's much easier than, how long ago now? Almost 30 years ago, when I was looking to do this. And so hopefully that's helpful, Jillian. I know that you'll find your answer, and I appreciate you sticking with this, especially the natural route, because keep in mind, antibiotics for a sinus infection have a 100% relapse rate. So if you want to look that up, you're welcome to. That's the unfortunate thing about them. And then, of course, look for environmental things like mold and other things that you may be sensitive to. All right. Thank you, everybody. Appreciate you tuning in this week into the Cabral Concept. Of course, we'll be back tomorrow with a brand new show on our Mindset and Motivation Monday. Take care. Thanks so much for tuning into today's show. Before you go, don't forget to hit that subscribe button. I want to make sure that you're getting our daily content, not missing out on anything functional medicine, wellness, weight gain, weight loss, anti-aging, living longer, stronger, and all of the most cutting-edge research. And if there's any topics you want to hear, feel free to leave them in the comments below. Take care.